Frank, how bad is the drug problem in Middle Georgia?
Herbert, I think the drug problem is a very serious problem, and it's as bad as it's been for years, or maybe even worse. You just don't hear as much about the drug problem in the media today as we used to hear 5, 6 years ago.
What can be done to correct it or to stop it or to slow it down?
Well, I'm a strong believer in prevention and education for our children. That's going to have a big impact, and I know for a fact that the Bibb County Board of Education has written several grants and invested money into substance abuse education for the schools. I've been working with them directly. I think that's a big impact. The other impact is how we treat people that have developed the disease of addiction, and that takes some time. We have a crisis stabilization unit out on Fulton Mill Road with 25 detox beds. Our average length of stay out there for this year so far is 4.8 days. So basically what we're doing, we're bringing people into medical treatment, we detox them, and then they go right back into the same environment that they came out of, which is devastating.
And so when they go back to the same environment after 4 or 5 days in, the chance of them starting back on the same process is pretty good, isn't it?
Yes, sir. It's very difficult for an individual to go back in that environment. You've stabilized them from a physical health standpoint, but the cravings have started by then.
What about crack cocaine? How bad is that? Is it getting better or worse? Or what's the situation with crack cocaine?
I don't know in terms of better or worse, but I do know there's a lot of it in our community.